Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 54 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at cheeks. The cheeks form the lateral, movable walls of the oral cavity and the prominent areas overlying the zygomatic bones. The principal muscle of the cheek is the buccinator. The buccal pad of fat is an encapsulated collection of fat located superficially to the buccinator muscle. The parotid duct opens on the inner surface of the cheek directly opposite the second upper molar tooth. Let's next take a look at the movements at the TMJs, also known as temporomandibular joints. All four muscles of mastication are innervated by the trigeminal nerve branch, V3. Temporalis muscle functions in elevation and retraction. Masseter muscle primarily elevates the jaw. Medial pterygoid muscle aids in elevation. Lateral pterygoid muscle contributes to protrusion of the jaw. Let's next take a look at the lesion of cranial nerve 12. A lesion of the 12th cranial nerve, cranial nerve 12, results in the contralateral genioglossus muscle, which is unaffected by paralysis, pulling the protruded tongue toward the paralyzed side. This leads to deviation of the tongue. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. During an oral examination, a dentist notices a small opening on the inner surface of a patient's cheek, directly opposite the second upper molar tooth. This opening is most likely associated with which of the following structures? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, parotid duct. The opening described on the inner surface of the cheek, opposite the second upper molar tooth, corresponds to the location of the parotid duct. The parotid duct is responsible for draining saliva from the parotid gland into the oral cavity. Its opening in this location aids in saliva release during chewing and swallowing. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, the submandibular gland has its duct opening on the floor of the mouth, not in the cheek. C, the lingual frenulum is a band of tissue that connects the tongue to the floor of the mouth and is not associated with the cheek. D, the sublingual gland has multiple ducts that open along the floor of the mouth, but not in the cheek. E, the submental lymph nodes are located beneath the chin and are unrelated to the opening described in the cheek. All right, now that we have covered this question, let's move on to look at the next question. A patient presents with difficulty chewing and complains of pain near the ears when opening their mouth wide. Which of the following muscles primarily contributes to the elevation of the jaw during chewing? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, masseter. The masseter muscle is a powerful muscle of mastication that primarily elevates the jaw during chewing. Dysfunction or weakness of this muscle can lead to difficulties in chewing and pain near the ears, which are common symptoms of temporomandibular joint (TMJ) dysfunction. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, the temporalis muscle aids in the elevation and retraction of the jaw, but is not primarily responsible for jaw elevation during chewing. C. The medial pterygoid muscle assists in jaw elevation, but is not the primary muscle responsible for this movement. D. The lateral pterygoid muscle is involved in protrusion of the jaw rather than elevation. E. The sternocleidomastoid muscle is located in the neck and is not directly involved in jaw movements at the temporomandibular joint. All right, now that we have covered this question, let's move on to look at the next question. A patient presents with difficulty protruding their tongue and complains of deviation of the tongue when it is extended. Examination reveals weakness and atrophy of the right side of the tongue. Which of the following describes the most likely phenomenon associated with a lesion of the 12th cranial nerve? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B. The contralateral genioglossus muscle contracts normally. A lesion of the 12th cranial nerve results in weakness or paralysis of the ipsilateral genioglossus muscle, leading to deviation of the tongue towards the affected side. However, the contralateral genioglossus muscle remains unparalyzed and can pull the protruded tongue toward the paralyzed side, causing deviation. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The ipsilateral genioglossus muscle is weakened or paralyzed due to the cranial nerve 12 lesion. C. Bilateral weakness of the genioglossus muscles would suggest a more widespread neurological issue, not characteristic of a cranial nerve 12 lesion. D. Absence of tongue deviation is not consistent with a cranial nerve 12 lesion, as deviation of the tongue is a hallmark symptom. E. Unilateral atrophy of the tongue is a consequence of muscle weakness or paralysis resulting from the cranial nerve 12 lesion, rather than the primary phenomenon associated with it. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is Fixer Med signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.